So, good evening to everyone, and welcome to today's wonderful evening with Sai, Sandeep, Pratyusha, Praveen, and many more who are all online. Pratyusha, Sai, you can open the camera. That's good enough if you can. And yeah, hi, Pratyusha. So, Pratyusha, you are from which medical college, doctor? Very good. Your voice is coming low, Pratisha. Anything you can do about it? Yeah. So yeah. So Sai, you are from which medical college?
Sir, I am also from Andhra Medical College.
Great. Hi, Praveen. Praveen, your voice is muted. Unmute your voice. Yeah. Good.
Sir.
So Praveen, you are from which medical college?
Pushkar, Ukraine, sir.
Good. So it is obviously, yeah, it's most of the times very boring to study alone. So that is the reason, instead of a teacher teaching, let us play together. We call this as a combined study session. I'm really thankful to Sai, Praveen, Pratisha for taking the initiative to join this group discussion. So we will take up around 100 questions and we will run it randomly, and we will go like Praveen followed by Pratyusha followed by Sai, Sandeep, and we will go in the same rotation, one after the other question. You can tell 1-2 points that you have studied or that you are very good with about each of these questions. So that is how the order goes by. So let me share the screen. Yes. Yeah, I think now we are online. So let us make the start with Praveen. Left gastric vein, where does it drain into? Left gastric vein. Yeah? Yes, Praveen. Can you kindly be loud?
Portal vein, sir.
Very good. Portal vein. Any points you want to say about it?
Sir, because the audio is little coming late to you, I feel, sir.
Okay, no. It's audible. It's audible. Please. Any other points that are there in your mind?
Sir, both left gastric vein and the right gastric vein drains into portal vein, sir.
Good. So the left and right gastric vein, both of them drain into the portal vein. The short gastric vein and the left gastroepiploic vein, this is one of the favorite questions, join the splenic vein, and the right gastroepiploic vein joins the superior mesenteric vein is what we need to remember. Now the next question to Pratyusha is a patient who has undergone a neurological lesion is being shown. And looking at this MRI and the appearance, the patient is supposed to have an impaired or a decreased secretion from all these glands, except which gland?
It's from parotid gland, sir.
Very good. So, what is the nerve involved and what is the secretomotor fibers of the parotid gland, Pratisha?
The nerve involved is the facial nerve. Secretomotor fibers of facial nerve supplies to the sublingual, submandibular, and lacrimal gland, but not to the parotid gland.
Very good. And what is parotid secretomotor is supplied by doctor? Parotid gland secretomotor fibers. Typically, the parasympathetic input comes from the glossopharyngeal nerve, is what you need to remember, via the otic ganglia. Whereas submandibular, sublingual glands, they basically receive from the facial nerve, and it is the submandibular ganglion which you need to remember. Now the next question goes to Dr. Sandeep. A structure which is injured while you are resecting along this area. So what is this area? And what is the structure which is injured while you are resecting include all this except? Yes, doctor.
Sir, hepatic vein, sir.
Okay. So what is this
Because
structure?
Sir,
Yes. What is the structure that we are talking here?
it is the right margin of the lesser omentum, where the bile duct is present, and the hepatic vein is somewhat upper to that portion, sir.
Very good. Very good. So the right to free
That's
margin
why
of the lesser
in
omentum
resecting the
yes, portal vein, common bile duct, hepatic artery, and the hepatic plexus of nerves. These are all the things that are there along the right margin of the lesser omentum is what you need to basically remember. Now, coming back to Praveen, about the tongue, what is the incorrect statement out of this? About the tongue, yeah.
The posterior most part of the tongue develops from first pharyngeal arch.
Right.
Because
So, yes, from where is the posterior part of the tongue develops from? Any idea, Dr. Praveen?
fifth pharyngeal arch. Fourth and
It is
five.
the fourth
Actually, the
pharyngeal
five disappears.
Yeah. Yes, very good. So, genioglossus is the safety muscle. Glossopharyngeal nerve supplies the circumvallate papillae, and the facial nerve supplies the fungiform papillae. They're all considered to be the true statements, is what you need to remember. Whereas the posterior most part of the tongue develops from the third median swelling arising from the fourth pharyngeal arch. Once more, pharyngeal arches is the short NEET PG topic that you need to make a note of it. Okay? Now, the next question to Pratisha. Tibial nerve injury causes what?
Dorsiflexion of foot at ankle joint.
Very good.
Foot drop.
And what is, yeah. So what is the muscle injury, doctor?
Muscles involved are anterior compartment of leg muscles.
Very good. So it is the deep peroneal nerve that supplies anterior compartment, and that lead to the dorsiflexion of the foot to be lost whenever there is any tibial nerve injury, is what you need to remember. Another thing is, what is the cutaneous innervation of the tibial nerve is a favorite question. Tibial nerve supplies the lower half of the back of the leg, the lower 1/3 of the lateral area of the calf, and the whole of the lateral border of the foot till the tip of the little toe. That's a point you need to appreciate. Now, the next question goes to Dr. Sandeep. Breast is supplied by all this except.
Sir, musculophrenic artery, sir.
Okay. Any comments?
It is a branch of internal memory artery, sir. But it supplies the diaphragm, sir. That's why it's named as musculophrenic artery.
Very good. So we need to remember musculophrenic, which is a branch of internal memory, mainly gives branch to the diaphragm, is what we need to remember. Whereas lateral thoracic, internal memory, and superior thoracic artery, they all supply the breast, is what you want to underscore. Now, the next question goes to, I think we lost Praveen. All right, Pratisha, what is your answer? A person is falling like this, you see all this except what?
Decreased sensation of medial side of the hand.
Okay, so this kind of injury is more likely to lead to upper or lower part of the brachial plexus injury.
Upper brachial plexus.
Very good. So it is the upper trunk of the brachial plexus which get injured. So there is a problem with the pronation of the forearm, paralysis of deltoid, inability to initiate the abduction of the shoulder is what you need to basically remember. And there is an inability to initiate abduction because there is an injury of which nerve, doctor, in the Erb's palsy? It is the axillary nerve.
Axillary nerve.
So
Deltoid
that's
muscle.
what we exactly. Now, the next question goes to Sai Sandeep. Posterior cutaneous nerve of the thigh. It supplies the skin overlying all these areas except.
Sir, lateral aspect of thigh, sir.
Very good. Any idea about lateral aspect of thigh supplied by whom?
Lateral cutaneous.
So the posterior cutaneous nerve
Lateral
supplies.
cutaneous nerve.
Right. It is the medial side of the thigh, the popliteal fossa, and the proximal part of the back of the leg, which are supplied by the posterior cutaneous nerve of the thigh. Now, Dr. Pratisha, which is not the boundary of the femoral ring? Which does not form the boundary of the femoral ring? Yes, doctor. Yeah.
Connection is lost. Femoral
Yeah.
artery, sir. Femoral artery.
Very good. So we need to remember that the femoral ring is bounded anteriorly by the inguinal ligament and posteriorly by the pectineal ligament, medially by the crescentic base of the lacunar ligament. So the boundaries are one of the favorite area of the examiner. I think Keertana also joined. Praveen also rejoined. Hi, Keertana.
Hello.
Hi, Doctor. Dr. Keertana, good to see you. Yeah. So, Praveen also has joined. Good. So, meeting together every day evening, picking up a set of questions and doing the revision. That is the best way that we can inspire ourselves to be ready for a fight, which is generally together we can be able to become stronger and achieve and make the preparation fun. So that is the whole idea. So Dr. Keertana, you are from which medical college, doctor?
For Andhra Medical College.
Very good, very good. So you're all guns of Nevron and Scud missiles of the Andhra Medical College. Very nice and proud to see you, doctor. And good, Praveen is back into the game. Good, Praveen. Now, the next question, during the incision and drainage, this question goes to Keertana. During the incision and drainage of the abscess in the area which is being shown, which nerve can get affected? What is your answer, Keertana?
Inferior rectal nerve.
Superior?
Yes, sir. B. Inferior rectal nerve.
Inferior rectal or superior rectal, doctor?
Inferior rectal nerve, sir.
Good. It is the inferior rectal nerve. So you should know that the ischiorectal fossa, the contents of ischiorectal fossa is the most important MCQ that you must NEET PG exam. So it is the inferior rectal nerve, the posterior scrotal and posterior labial nerve, and the vessels are the contents of the ischiorectal fossa is what you need to remember. Now, which vessel is just lateral to the direct inguinal hernia? The question to Praveen. Yes, doctor.
See, inferior
Yes.
epigastric artery.
Very much. So we should know the Hasselback's triangle. Any points you want to talk in this point, Dr. Praveen? Relevant to this that you want everyone to remember? Very good. In online we have Dr. Mona and many more who are all online. Good, doctor. So we need to remember that direct inguinal hernias are the hernias within the floor of the Hasselback's triangle, and They are more common in the older people, and it is the inferior epigastric vessels laterally, lateral border of the rectus abdominis muscle medially, and the inguinal ligament inferiorly, which are the boundaries of the Heidelberg triangle, is a short MCQ in the tomorrow's NEET PG exam. Now, Doctor, the next question. To evaluate hypoglossal nerve function, a patient asked her patient to protrude the tongue. The tongue deviated to the right side. So that means where is the paralysis? My question to Pratyusha. Yes, doctor.
Right genoglossus, sir.
Very good. So any comment on this?
Since
Sir,
the right side of the
Yes.
right side of the nerve is paralyzed, so the left part of the trunk tries to protrude to the right side.
Beautiful. That's right. So it is when the right genioglossus is paralyzed, the left genioglossus pulls the tongue forward and to the right. That is what we need to remember. Now, with regard to the blood-brain barrier, my question to Dr. Sandeep is, what is correct about blood-brain barrier?
Sir, the substance which should cross the blood-brain barrier should be the non-polar substance, sir. So the polar molecule crosses the blood-brain barrier less readily than the non-polar molecule is the wrong, is correct.
Okay.
That statement.
So what is
The
your
which
answer?
state? D, sir.
Okay, good. So the polar molecules cross the blood-brain barrier less rapidly or less readily than the non-polar is very important. So that is the reason the L-DOPA, not the dopamine, can cross the blood-brain barrier. So the L-DOPA crosses the blood-brain barrier, and later it is converted into dopamine within the brain to produce the desired effect is what you need to remember. Now, when the embryo is developing, from where does the ureter develop from? My question to Dr. Kirtana. Yeah.
Metanephric diverticules, option. The
Very good.
ureter, renal, pelvis, calyces, and the collecting tubules rise from metanephric diverticule.
Good. Any point that you want to additionally want us to remember?
The other ones, sir, which arise from the metanephric diverticulum, like renal calyces, collecting tubules, and renal pelvis.
Wonderful.
Also developed in metanephric.
So the metanephric diverticulum or ureteric bud gives rise to ureter, renal pelvis, calyces, and collecting tubules is what we need to remember. Now my question to Praveen. The gut-associated lymphoid tissue most extensively is developed in which areas of the GIT?
So galt is mainly in large intestine. So one among the answer will be like D, that is colon.
Very good. So it is a colon where the large intestine, where the galt is extensively developed is what you need to remember. Now, suprarenal gland medulla. So what is your comment about it, Dr. Pratisha?
It contains the chromaffin cells. It contains chromaffin cells.
Right. Right. Very good. That's where your pheochromocytoma arises from the suprarenal medulla, and suprarenal medulla is derived from the neural crescents, which is associated with the sympathetic nervous system. That is what need to be remembered. Now, Dr. Sai Sandeep, the anatomical left and right lobes of the liver, they are separated by the diaphragmatic surface of the liver. What is the structure which is separating them?
Sir, falciform ligament.
Okay. It is a falciform ligament which is the separating one. The left liver includes the caudate lobe and most of the quadrate lobe. That's what we need to remember. And the anatomical left lobe, typically, am I audible? Am I audible, doctor?
Yes, sir. Yes.
Yes, sir.
Yeah. The anatomical left lobe is separated from these lobes on the visual surface by the fissure of round ligament of the liver and the fissure of the ligamentum venosus. Once more, doctor, Covenoid's classification. If you have not yet prepared for this, please keep a 100 pages notebook. And remember, this is a sure short topic in the tomorrow's NEET PG exam. Be very sure about it. On the diaphragmatic surface, you have the anatomical left lobe separated by the attachment of the falciparum ligament is what you need to remember. Very good. Now, my question goes to Dr. Keertana. You are inserting a needle along the upper border of the 10th rib at the mid-axillary line. Then what is the structure which can get affected by doing that?
Along the mid-axillary line, it will be liver, sir.
Very good. And any points to remember? So, typically, you need to remember that you are passing the needle along the upper border of the 10th rib at the right mid-axillary line, right? So, you need to know that you perform thoracosynthesis above 7th rib in mid-axillary, the 9th rib along along the 11th rib along the posterior scapular line is what you need to remember. And if you pass the needle lower than this point, the chance of injuring the abdominal structures is there. So that is the reason, as Keertana rightly says, liver is the organ which is very close to that, and there is a chance of injuring the liver. So if you look at the lower border of the pleura on the right side, mid-clavicular is 7th rib, mid-axillary is upper border of 10th rib, and paravertebral is 12th rib. On the left side, once more, 7th rib, 10th rib, 12th rib. That's how they need to remember. Now, the next question, doctor. The question goes to Praveen. A 26-year-old female presents with 3-month history of amenorrhea. Her breast has become engorged, and you have asked for a pregnancy test which is negative. Probably, which disturbance in the dopaminergic pathway lead to the galactorrhea as a symptom, doctor?
So mainly the hormone responsible for this is prolactin. It's among the options will be infradental. So that leads to this hyperprolactinemia.
Okay. So it is the tubero-infundibular system which is important. So we should know mesolimbic mesocortical system regulates our behavior. You can easily remember limbic system is all with emotions and everything, and schizophrenia mainly is due to mesolimbic mesocortical system. Always remember, meso means midbrain. Nigrostriatalis, it is the voluntary movements, Parkinsonism. Tubero-infundibular is hyperprolactinemia. That's how you need to remember. Now, the left gastrovomental artery, from where does it arise from? My question to Pratisha.
Sir, it arises from splenic, sir.
Very good. Any points you want us to remember?
It runs along the greater curvature of the stomach, and it anastomoses with the right side of the one.
Very good. So it is the splenic artery. The left gastrovomental artery arises from the splenic artery, and it courses along the greater curvature and anastomoses with the right gastrovomental artery is what you need to remember. Wonderful. Now my question goes to Sai Sandeep. A 28-year-old man came to emergency. There is an injury on the forehead. Now the simple question we like to ask is, What are the layers of the skull and what is the structure which overlies the epicranial aponeurosis?
Sir, that is connective tissue, sir. The layers are skin, connective tissue, aponeurotic tissue, aponeurotic layer, loose areolar tissue, and pericranium, sir.
Very good, wonderful. So the skin connective tissue, the aponeurosis, loose connective tissue, and the periosteum, that is the order in which we need to remember, one of the favorite areas. And now, doctor, a 40-year-old woman, bowel and bladder dysfunction, excessive perspiration, pallor and giddiness, and there is a lesion in a part of nervous system. So most likely, where is the defect located is the question, Dr. Kirtana.
Sir, as there is a bladder dysfunction and all, got to be autonomic nervous system.
Very
As
good.
there is perspiration, etc. These are mainly caused because of the damage to the autonomic nervous system.
Very good. And which is called thoracolumbar outflow and which one is called craniosacral outflow between sympathetic and parasympathetic, Dr. Kirtana?
Thoracolumbar is sympathetic, sir. Craniosacral is parasympathetic.
Beautiful. So that is what we need to remember. Now, big dolorex is that sharp pain in the distribution of trigeminal. Now, with syndrome, basically, it involves neurons that have their cell bodies in which location? My question goes to Dr. Praveen.
This is involving the trigeminal ganglion, sir. So here among the options it will be D, Gesserian ganglion, sir.
Gesserian ganglion, absolutely right, doctor. So the otic, pterygopalatine, submandibular ganglia, these are all parasympathetic. The geniculate ganglion contains the sensory neurons of the facial nerve, is what you need to remember. Now, once more, a question to Dr. Pratisha. Which is the location of the primary outflow of the sympathetic nervous system from the CNS?
Thoracolumbar, sir.
Absolutely, just now we discussed. Now, syndrome of inappropriate ADH secretion, SIADH. Now, my question to Dr. Sandeep, what is the important finding in this?
Sir, in this, there is increased Na plus eggs from the urine, sir.
Very good. Can you be able to give me a reason why urinary sodium increases in SIADH? Little difficult.
Sir,
Very simple.
Because there is decrease
you have
in
an
the
information, doctor? You should remember, if there is an increased ADH, what will happen, Dr. Sandeep? There is an increased or decreased volume retention?
Sir,
If there is
increased volume retention.
right, increased water retention. With that, what will happen to plasma volume? Will it increase or decrease?
Increases.
If the plasma volume is increased, what happens to the atria? Will they be stretched or they will be in a more contracted shape? If there is an increased plasma volume.
Sir?
If the plasma volume increases, what happens to the atria? Will they be more stretched or will they be contracted?
More stretches, sir.
If they become more stretched, what is the substance that the atria release?
Natriuretic peptides.
Natriuretic peptide. And what will natriuretic peptide will do on the kidney? Will it increase or decrease sodium loss?
Increases the sodium.
So it leads to natriuresis. So increases sodium loss into the urine. So that is the reason urinary sodium is high as one of the biochemical parameters in case of SIADH. So increased ADH, increase the water retention and increased plasma volume, increase in stretching, leading to increased ANP, leading to the increased urinary sodium. That is what you need to basically remember. Then what are the other two biochemical parameters in SADH? Whenever SADH is there, lot of plasma volume increasing. I mean the water inside the plasma increasing. So that is the reason urinary osmolarity will be increasing, plasma osmolarity will be decreasing, and urinary sodium will be increasing. The combination is what you see in the case of syndrome of inappropriate ADH secretion is what you need to emphatically remember. That's good, doctor. Now my next question goes to Dr. Keethala. Central cyanosis does not occur when the total hemoglobin and reduced hemoglobin is how much?
Your option is A, 10.9 and 4.1. Because reduced hemoglobin levels must be greater than 5 in order to cause a central sinus.
Very good, very good. Now, Kirtana, can you tell me, have you heard this term called happy hypoxia in corona patients? Have you heard this term? No? Okay. Normally, when the oxygen saturation levels, SaO2 levels, fall below 90, people start developing cyanosis. But the patients who have the corona, typically, even when their oxygen saturation is 70, 65, still they are not showing the cyanotic signs. They don't show the cyanosis, which is unfortunately called happy hypoxia. But if the patient moves out of the bed, he puts few steps, then they will end up into a collapse, and suddenly oxygen sat will fall down. So that is the story of happy hypoxia, which is going to come in the tomorrow's NEET PG exam. Now, doctor, am I audible? Am I audible, doctor?
Yes, sir.
Yes, sir.
Okay. Now, the next question. Second messengers. Which is the second messenger out of this, Dr. Praveen?
D, calcium, sir.
Very good. Calcium is a very well-known one. Now, let us run very rapidly. Pratyusha, parathyroid, what is true?
It increases the resorption of bone, sir. It actually increases the calcium levels in the blood.
Very good. High PTH is synonymous with hypercalcemia. That is what we need to remember. Now, my question to you is, once more, Pratisha, is what is the effect of parathormone on the phosphate levels in the kidney? I mean, phosphate in the blood, rather. What will it do to the phosphate? Will it cause increased? Yeah.
Increase.
Very good. So it leads to increased phosphate loss and decreased calcium loss. So that is the reason there is a typically development of hypercalcemia. Good. Now, doctor, these are all the effects of oxygen hemoglobin dissociation curve, except what? My question to Sandeep.
Chlorides.
Good. 2,3-DPG, CO2, acidosis, they do have an effect. Now, interesting question, Kirtana. Spirometry measures all these except?
Functional residual capacity.
Why?
Because residual volume, in order to calculate FRC, we need residual volume. By spirometry, we cannot really measure residual volume.
Absolutely. Now, polar amino acid out of this is which one, Dr. Praveen?
D, valine, sir.
Very good. So the list of polar, non-polar, acidic, basic, all that amino acid stuff, no, doctor, you have to invariably make a note, be very sure about it. Now, the question to Dr. Pratisha. Irreversible steps in glycolysis, what are they?
Involving the enzymes hexokinase, phosphofructokinase, and pyruvate kinase.
Beautiful. So hexokinase is the key glycolytic enzyme, and the kinase reactions are always reversible, is what you need to basically remember. And good to see Sushmita Das, Jay Prakash, Mona, Abhishek, and many more who are all online. Almost 21 online classmates. So please keep answering, doctor. You also please mention on the chat some good points that come to your mind. That's how we can be able to finish more and more number of questions. A brisk revision every day evening at 6 o'clock. High energy phosphate compound is which one, Sai Sandeep?
Creatine phosphate.
Absolutely. Now, in urea cycle, which enzyme is involved, Dr. Kirtana?
For argininosuccinate synthase.
Absolutely. So, all steps, which urea cycle enzymes are mitochondrial and which urea cycle enzymes are cytoplasmic, you are to be 100% sure. Definitely, one question invariably comes from the urea cycle, doctor. Now, the next question to Praveen. For the gallbladder contraction after a fatty meal, which is the enzyme involved?
Cholecystokinin.
Absolutely. So cholecystokinin makes gallbladder contraction, pancreatic enzyme secretion. Now, Dr. Pratusha, a postsynaptic neuron receives input only from one presynaptic area. So, which is the characteristic of the neuronal pools that exist in the postsynaptic neuron?
Temporal summation, sir.
Very good. So there are two types. One is called temporal summation, other is called the spatial summation. And since there is only one presynaptic neuron and one postsynaptic neuron, temporal summation is the only possibility that can happen in the postsynaptic neuron is what you need to remember. Then what is the meaning of occlusion? Occlusion means when two neurons reach one neuron at the same time, they have an effect less than if they had reached the neuron at separate times. That's called the phenomenon of occlusion. And where do you see spatial summation? Whenever multiple neurons are converging onto a single nidus, then you find spatial summation. Now, my question to Sai Sandeep. What are the two main projections of the optic nerve? One is occipital lobe of the cortex and the other one is?
Lateral geniculate body.
Which one?
Option C, sir.
Very good, very good. So now my question to you is, doctor, lateral geniculate body, medial geniculate body. What is medial geniculate body associated with?
Hearing, sir.
Hearing, very good. Now, the second question. Superior colliculus, inferior colliculus, which is with vision, which is audition?
Inferior colliculus is with vision, sir.
Oh, no.
Oh, superior colliculus is with vision and inferior colliculus is with hearing, sir.
So, since you understand Telugu, I'll tell you. Superior colliculus sustadi. Inferior colliculus intadi. May not be completely understandable for the non-Telugu students. Superior colliculus sustadi. Inferior colliculus intadi. So that's what you can remember. So otherwise you can remember superior colliculus will be seeing. Inferior colliculus you can remember Incus, which is our company name. So Incus is into audition. So that's how you can remember. Then one more thing you need to know. Medial lemniscus and lateral lemniscus. Lateral lemniscus is associated with which pathway? Who is going to tell me? Pratyusha, Sandeep, Kirtana or Praveen? Lateral lemniscus is associated with which pathway? Any answer? Lateral lemniscus is with which pathway? Is it auditory or visual pathway or sensory pathway?
Sensory, sir.
Any guess? Yeah, Praveen, make one wrong answer, we will be happy. You know, the whole purpose of combined study is our classmates will make wrong answers. That is an encouragement for us to study. Come on, Praveen, at least make one wrong answer so that we are encouraged to study. Your voice is not audible now. Okay, Pratisha, you make the wrong answer.
Lateral is sensory.
Auditory, sir.
Very good. So lateral lemniscus is auditory pathway. Medial lemniscus is all your dorsal columns are there, no doctor? That is cuneate and gracile tract. Cuneate and gracile tract. These sensory pathways, after reaching the lower part of medulla, they undergo decussation to opposite side, and they travel as medial lemniscus. Always remember, lemniscus means what? Lemniscus carries second order neurons. Lemniscus carries second order neurons. The one which carries second order neurons को कहते हैं lemniscus. That is the point you need to basically remember and appreciate. Very good. I am so happy to see quarter century, almost 25 classmates in the today's evening. Very good, doctor. So once more, I want to summarize for everybody. Don't forget, lateral geniculate body, medial geniculate body. You should not forget. Lateral geniculate body, typically eyes are medial. Eyes are medial to ears, but eyes are lateral geniculate body, and auditory is medial geniculate body. Ears are lateral, but it is a medial geniculate body. Once more, superior colliculus, inferior colliculus. Superior colliculus is associated with vision. Inferior colliculus is auditory. Then one more important point you need to remember is lateral lemniscus, medial lemniscus. Lateral lemniscus is associated with auditory pathway, and medial lemniscus is continuation of dorsal columns. Last thing you should not forget: superior olivary nucleus, inferior olivary nucleus. Inferior olivary nucleus is present in both of them, basically are there in the medulla. So what is inferior olivary nucleus associated and what is superior olivary nucleus? Can anybody tell what is superior olivary nucleus associated with which pathway?
Auditory.
Any guess? Yeah? Auditory pathway, right? Auditory pathway. Whereas inferior olivary nucleus, all the spinal cord information has to go to the cerebellum, right? Because cerebellum need to receive all that information. Then cerebellum will talk with your cerebral cortex while your movement is planned. So all the sensory information first gets reported to the inferior olivary nucleus. From there it will go through the inferior cerebellar peduncle to reach the cerebellum, and from there it will be going up to reach the red nucleus in the midbrain, and from there it will be going to reach the cerebral cortex. So that is the reason you need to remember it is a circuit. Inferior olivary nucleus to the cerebellum to red nucleus to the cerebral cortex is what you need to remember. Now, doctor. Yes. Fastest acting enzyme is which one? Pratisha, what is your answer?
Carbonic anhydrase, sir.
Absolutely. Now, Dr. Sandeep, a 34-year-old male alcoholic came with upper GI bleeding. Now the question is, what is the type of acid-base disturbance in a person who is profusely vomiting? What acid-base disturbance he will have?
Sir, ions are continuously being out of the body. So due to that, the anion gap occurs. That's why the disturbances occurs.
Okay. So what is your bet? What is your answer?
Metabolic alkalosis.
Right. So you should remember why metabolic alkalosis occur. I will try to quickly explain you. Typically, you are vomiting. If you are vomiting, what is happening, doctor? What happens to your plasma volume? I think Sai Sandeep is going to become an endocrinologist. Every time a question of endocrinology is landing with Sai Sandeep, or maybe he may become a MD general medicine after NEET PG. What is your dream branch, Sai Sandeep?
I don't have any dream branch.
Oh my God! You should have a dream doctor. You should have a dream girl and a dream branch, right? So be very sure. So okay, if there is a vomiting, what happens to plasma volume, Sai?
Decreases.
Very good. Then what happens to the renal plasma flow?
That it also decreases.
That also decreases. And what will happen to the juxtaglomerular apparatus? Will it be stimulated or inhibited?
They will be inhibited, sir.
Decreased renal plasma
will be-
flow stimulates. And
Yes,
the
sir.
stimulation of juxtaglomerular apparatus, what does it release?
Renin, sir.
What does it release? Renin. Very good. And renin will cause an increase in
Plasma, sir.
aldosterone. And what is the effect of aldosterone on the renal? Sorry. What is the effect of it on the renal tubule? Will it cause sodium retention or loss?
Retention.
Aldosterone will cause retention of sodium and loss of potassium and H plus ion into urine. And because of that loss of H plus ion into the urine, there is a development of metabolic alkalosis, right? Metabolic, and it leads to metabolic alkalosis. And what is lost into urine? H plus ion. That is the reason what you have aciduria. And why this is called paradoxical aciduria? Actually, the person is vomiting. What is he vomiting? He is already vomiting acid out. When he is vomiting the acid out, urine also is losing the acid out. That is not expected, right? The urine is supposed to have less acid. But the person has more acid in the urine. That is the reason it is called paradoxical aciduria, is what you have to emphatically remember. That's good. Now, doctor, 43-year-old male is being evaluated for painful muscle cramps. The patient's serum sodium is 135, potassium 4.4, calcium is 7. Now, possibly, what is the most likely background history possible in this patient with muscle cramps, and any light tapping on the chin is causing the spasm, carpopedal spasms? So the question goes to Dr. Kirtana. Yes, doctor.
Thyroid surgery, because the calcium level is less than 7. This is because of hypoparathyroidism. So during a thyroid surgery, he might have gotten his parathyroid glands removed or something, led to this condition.
Absolutely, doctor. Absolutely. Now, a healthy human volunteer is given a IV infusion of PAH solution. Now, in which nephron segment is the PAH concentration lowest? My question to Praveen.
It is filtered by the glomerulus, and here among the options A is Bowman's capsule, and it is after filtering is being secreted by the PCT. So we will confuse between A and B. So if it is asked in other way, we should mark PCT, and if it is like which segment of pH is concentrated lowest, then it will be like Bowman space.
Absolutely. Wonderful. So it is the Bowman's capsule where pH is filtered in the glomerulus and subsequently secreted into the nephron lumen by the proximal tubule. That's the reason it is lowest in the luminal fluid in the Bowman space is what you need to remember. So this is how inulin and mannitol, no tubular resorption or secretion. Filtered amount equal to excreted amount. Glucose, sodium and urea, there is a tubular reabsorption. Hence, excreted amount will be less than the filtered amount because it is coming back. Then PAH and creatinine, there is a tubular secretion. So, excreted amount will be more than the filtered amount. This is the favorite question of the examiner. Now, doctor, a 64-year-old overweight female, diabetes, she had been on hemodialysis for the past 5 years for the end-stage renal disease. Most likely, what is metabolic derangement in a case of the chronic renal failure? The question goes to Pratyusha.
Sir, osteoarthritis fibrosa cystica.
Wonderful. Any comment you want to give?
Since end-stage renal disease, vitamin D will not be produced, so calcium absorption decreases and phosphate excretion will be decreased. Hyperphosphatemia and hypercalcemia results in deposition of that in different parts of the body, resulting in osteoarthritis fibrosa cystica.
Beautiful. So you almost hit the gun, but one point is vitamin D decrease will lead to hypocalcemia. Hypocalcemia leads to increased parathormone. Secondary hyperparathyroidism. Parathormone leads to development of excessive bone resorption, which is responsible for osteoarthritis fibrosa cystica is what you need to remember. Now, doctor, what is the best test to confirm menopause as a cause of amenorrhea? Sai Sandeep.
Sir, serum follicle stimulating hormone levels.
Right. So there will be high levels of
Serum follicle stimulating hormone levels. FSH.
So typically, whenever the ovaries are decreased production of estrogen, there is no negative inhibition on the pituitary. So that is the reason there is an increased FSH production is what we need to remember. Now, glomerular filtration rate and renal blood flow, they both will be increased in which situation, Dr. Kirtana?
So if the efferent and afferent arterioles both are dilated, the renal blood flow increases as proportionately GFR also increases.
Absolutely right. Now, if 600 ml of water is ingested rapidly, how much will the plasma volume will increase by approximately? The question to Ravi.
Sir, among 600 ml, only 1/12 of is been always ingested by the plasma. So 1/8 it will be around 50 ml. So the option will be D, sir.
Very good. So typically, only 1/12 of the total body water volume, the plasma volume is. So only 8% of ingested volume will remain in the plasma is what you need to remember. So commonly, one of the favorite question is 60% of the body weight of the individual is total body water. Please don't forget. That means if you have a 70 kg individual, typically around 42 liters will be the total body water is what you need to remember. Now, my question to Pratisha. With age, the lens of the eye become less elastic and less bending of the light rays. So the consequence of this is that the eye is less able to do what?
Focus on near objects.
So that is what we call it as
My
presbyopia. presbyopia. Very good. Now, doctor, the control of the muscle in standing and moving is not something we are able to do from birth. So what is the order of the muscles from the first skill to the last skill that the babies learn to coordinate and control is the question to Sai Sandeep.
Sir, option B, sir. Muscle of the neck, muscles of the shoulder and arms, and finally the muscles of the body.
Very good. The muscles of the neck, the muscles of the shoulder and arms, and the muscles of the body is what we need to remember. Raju Jhat is asking, sir, 46th question I did not understand. What is 46th question? Acha, very good. Praveen, Professor Praveen is asked to explain it once more. Raju is asking, what is the correct explanation? Yes.
So normally, whatever the body water content we have, only 1/12 of the content will be added to the plasma water. So if you calculate 600 in one part of 600 into divided by 12, we will get 50.
Very good. Thank you. So that is what we need to understand. So thanks to this YouTube creators, because it is as good as a classroom. There is nothing. I think physical classrooms are a history. Nobody will go and sit in a contained classroom where it is difficult to express with about 300-400 students in a live classroom, right? So that's the point. Good. Now, doctor, the next question: which can be synthesized in the body out of all this, Dr. Pratusha?
Vitamin K, sir.
Absolutely. And can you tell me, Pratusha, what are the clotting factors dependent on vitamin K?
2, 7, 9, 11, 13.
No, 9, 10.
10.
And protein C, protein S.
Yes.
They're also vitamin K dependent. Only thing is these are anti-thrombotic and these are pro-thrombotic. For both Kauravas and Pandavas, still the grandpa is the same. That is a vitamin K. That's what you need to remember. That's the reason whenever you give warfarin, the whole purpose is warfarin should make prothrombotic factors to get inhibited. But unfortunately, warfarin also will cause anti-thrombotic factors also get inhibited. That's the reason when you give warfarin, initially there will be a thrombotic tendency. Why initially thrombotic tendency? If you take 2, 7, 9, 10, protein C, protein S, they have a lower half-life. So the moment you give warfarin, first to fall are the protein C, protein S. That's the reason initially there is a thrombotic tendency. After that, this anti-thrombotic efficiency will take off. That's the reason always the principle is when you start warfarin, accompany it along with the heparin is what you need to remember. Now, doctor, question number 50 to Sai Sandeep. Yeah, cardiomyopathy is deficiency of?
Selenium.
And what is that called? Keshan's cardiomyopathy. Very good. So what is the cause of homocystinuria, Kirtana?
So deficiency of vitamin B12.
Very good. And so you should know that this is one important, a lot of times the students have a challenge to remember this. Methionine becomes homocysteine, that becomes cystathione to cysteine. Homocysteine to cystathione you call cystathione beta synthase, which is pyridoxine dependent. But homocysteine converts back into methionine, which is a vitamin B12 and folate dependent enzyme. So if there is a B12 deficiency, homocysteine cannot convert back into methionine, and that typically lead to development of hyperhomocystinemia and homocystinuria is what you need to fundamentally remember. Now the next question goes to Dr. Praveen. All these have antioxidant properties, except
C. Citrulline.
very good. So tocopherol, glutathione, lycopene, etc., etc. Kitana, about NK cell, what is wrong statement?
So depends on antibody for
Okay. So this is called antibody ADCC is what you need to remember. ADCC, antibody dependent cell mediated cytotoxicity. That means you have a cell-mediated immunity and you have a humoral immunity. This is B lymphocytes and this is T lymphocytes. Only the NK cells have a capability of doing both the things. That is the reason they are used for two things. All these viral infections and tumor surveillance. Tumors, killing the tumor and killing the virus. That is the job of the NK cell, is what you need to remember. And we will discuss more about it later. But please remember, 5 points about NK cell should be there in your tips next time once we come across a question based on this. Now comes the most inevitable, dirtiest question. Sandeep is going to answer. Macrophages release all these except
Interleukin 2, sir. Option A.
very good. So please remember, today a lot of patients of corona are all dying because of what cytokine storm. So that is the reason this time NEET PG exam, if there is no question on interleukin 2, on interleukins, 1 minute. If there is no question on interleukins, I bet it won't happen like that. So please don't forget, make a list of interleukins, sure short question in the NEET PG 2021 or any NEET PG for that matter for next 1 century until your great grandchildren are also taking the exam. Definitely aayega. So on the same YouTube channel, we created one mnemonics on interleukin and made a video. You can review that, or you can make your own mnemonics also. Now, doctor, glycolysis in erythrocytes in aerobic conditions, the terminate product is lactate. Why? What erythrocytes won't have? Yeah.
Mitochondria.
Absolutely. Now, you should not forget, this is another sure short MCQ in the NEET PG tomorrow. It should go into your 200 pages dirty book. Dirty book. There is something called dirty book. For everybody, every NEET PG topper will say, I have a dirty book of my own. Krebs cycle, electron transport chain, oxidative phosphorylation, beta oxidation, mitochondria. Glycolysis, glycogenolysis, glycogenesis, HM fission, cholesterol synthesis, bile acid synthesis, they're all cytosolic. So you should know what are the enzymes of urea cycle in cytosol and mitochondria. Now the next question goes to Sai. Long chain fatty acids penetrate the inner mitochondrial membrane. How do they?
Keratin derivatives.
Absolutely. So it is the carnitine which is important as a shuttle in order to shift them, and melanyl CoA is the inhibitor of this carnitine shuttle is what you need to remember. Now the next question. Urea, I think easiest question. Kirtana. Urea is the end product of?
amino acid nitrogen metabolism.
So why these kind of questions are given is, NEET PG exam is also taken by senior government medical officers also. At least if they can answer urea is amino acid nitrogen metabolism, we will give under special quota a seat because after about 10-15 years service, they are taking exam means we should appreciate that. So that's the point. So the urea cycle enzymes you got to be 100% sure. Now 125 dihydrocalciferol is produced by Praveen.
Kidneys. B.
Yes, Praveen.
Kidney, sir.
Right. So kidney has 1-alpha hydroxylase, which converts the 25 into 125 dihydroxycholecalciferol. Now, the difference between the liver and the muscle, between hexokinase, glucokinase, which is there in liver, which is there in the muscle, Pratisha.
Hexokinase in muscle, glucokinase in liver, sir.
Hexokinase in muscle, glucokinase in liver. Is there any way to remember? Actually, H is hepatic, but hepatic does not contain hexokinase. Hepatic contains glucokinase. That's a way to remember. Now, which cellular activity is decreased when there is a exposure to insulin? Question to Sai Sandeep.
Gluconeogenesis.
Which one?
Gluconeogenesis.
Right.
Option C, sir.
Right. Any comments you want us to remember? It's easy to remember. When do you need to do gluconeogenesis? When you eat more glucose or eat less glucose?
Eat less glucose.
If you eat less glucose, your body endogenously need to produce glucose. So gluconeogenesis is stimulated when you eat less glucose and when you have hypoglycemia, basically. So if you typically insulin, when will insulin will be high? If you have hyperglycemia, insulin will be high. So when you have hyperglycemia, insulin will be high, and when you have hyperglycemia, gluconeogenesis is inhibited. So that is how you can remember what is the effect of insulin on gluconeogenesis. Now one more quick question to Kirtana. Is insulin a lipogenic hormone or a lipolytic hormone, doctor? Is insulin a lipogenic or lipolytic? What is your guess? Sorry?
Lipolytic.
Thank you, Kirtana, for giving a wrong answer. So that you are encouraging thousands of people like us. That's where we used to be thankful. Don't worry. Yumi also is putting a wrong answer, lipolytic. Good. So Yumi also is accompanying you online. So simple thing you can remember, Kirtana, that to any patient, if you give insulin injection, where will you give? For example, you will be giving onto the belly. So typically, people who take insulin injection, they typically put up weight, right? They get a fat accumulated. So always remember, insulin is lipogenic, is what you need to remember. Another way to remember is, those who have insulin deficiency have what? Diabetes. Diabetic people typically become emaciated. They don't have any fat. All the face will become shrunken. So lipolytic, if there is no insulin, the body becomes lipolytic. And those who receive insulin pick up the weight because it is lipogenic, is what you need to remember. Now, my question goes to Praveen. A 12-month-old female exhibits severe developmental delay, macrocephaly, dysmorphic faces, clouding of the cornea is not there, ivory-shaped lesions on the infant's back. Now, what is your what type of mucopolysaccharidosis?
A. Hunter's disease.
Any point you want us to remember?
because of multi-organ involvement.
Okay. Why not hurler? Why hunter?
Sir, it is
Remember, hunter. If you want to hunter, how should be your vision? It should be clear or cloudy?
clear.
Right. So clouding of the corneas is not there, means it is hunter. Whereas clouding of the cornea is there, means it is hurler. Right? That's how you can be able to remember. If your cornea is clouded, no, you can't see clearly. So you'll be hurling the objects here and there. That's another stupid way to remember. But sometimes we need to be slightly stupid to remember all the stupid things. So, doctor, these are the excessive Mongolian spots that you find in the patients who are having hunters is what you need to remember. All right. Now, catalase, my question to Pratisha. In which cellular organelle?
Peroxisome.
And what is the disorder where peroxisomes are abnormal? What is the disorder where peroxisomes become abnormal? It starts with letter Z. What is that? Zellweger. Very good. So Zellweger is basically peroxisomal dysfunction is what you need to remember. Now, the next question to Sai Sandeep. Tay-Sachs disease, you have cherry red spots, startle response, neurodegeneration. Now, the question is simple. What is the inheritance pattern, and accordingly, if an affected child is a carrier, what is the risk that their grandmother, what is the risk that the grandmother of an affected child is a carrier? Child is affected, what is the chance that the grandmother is carrier?
50%, sir.
So, in all these questions, you need to put the pedigree. Basically, RR and RR, and accordingly, you need to make the calculation. So, it is an autosomal recessive pattern of inheritance. Grandparents have a half chance of being carriers because one or the other must have transmitted the abnormal allele to the obligate carrier parent. Carbon monoxide affects the hemoglobin. So how does it happen? Yes,
Competitive binding to the things.
how does it competitive binding to the heme? Very good. Excellent. So carbon monoxide binds 220 times that of the oxygen. Now, pantothenic acid is necessary for which part of metabolism?
For the conversion of oxalic acid to citrate.
For the
Citrate.
okay.
Option D.
So
Oxalic acetate to citrate.
to oxaloacetate to citrate. So basically, oxaloacetate to citrate, you require CoA, and CoA is having the pantothenic acid is what you need to remember. Now, which protein is outside the nucleosome and helps in nucleosome packaging is my question to Pratisha.
H1 histone protein.
Very good. H1 histoprotein. The histone is located outside the nucleosome and helps to package the nucleosomes is what we need to remember. So, if you take H2A, H2B, H3 and H4, they're all typically in the core of the nucleosome. H1 is outside the core. Now, 3 to 5 exonuclease activity of the DNA polymerase 3. What is your comment, Sandeep?
Sir, it removes an improper base pair nucleotide during the replication, sir.
Right. So it is the excision repair function is there for the DNA polymerase II. Now, in this context, you need to know that this is one important table you need to remember, doctor. Topoisomerase II, it removes the supercoils. Helicase, it unbinds. Single-stranded binding proteins, they stabilize the unwound template. Primase, which is RNA polymerase, enables synthesis of RNA primer. The leading strand is DNA polymerase III. Lagging strand is by the DNA polymerase III, both of them. And ultimately, RNA primer need to be removed, and replacement of RNA with the DNA should be done, which is done by the DNA polymerase I. And all the Okazaki fragments of the lagging strand are joined by DNA ligase. So please don't forget, this is a sure short MCQ, definitely ek aayega is list se, that you need to remember. So what is that initiation codon piccola?
AUG.
Very good. And UAA, UAG, UGA, they're all called stop codons. Now, an irritable 6-month-old boy who has been vomiting for a day is brought to the emergency department. He has hyperammonemia, hypoglycemia, low serum ketones, error in fatty acid oxidation. So, what is the most likely possibility, Praveen? You have an answer for this, Praveen?
Sir, D, medium chain fatty acyl CoA dehydrogenase.
Right.
Because of this
So,
deficiency.
Absolutely. The most common genetic disorder of the fatty acid metabolism is medium chain fatty acyl CoA dehydrogenase deficiency. Most of the tissues, they have fatty acid oxidation as the main fuel source, because almost 129 ATPs are produced. One palmityl CoA molecule is being broken. But when the medium chain dehydrogenase deficiency is there, the medium chain fatty acids accumulate in the cytosol and in the mitochondrial matrix, and that lead to hepatic resynthesis of the triglycerides, and that lead to the fatty liver. So that is the point you need to remember. Now, the next question goes to Pratisha. What is the function of the enzyme activated by the calcium calmodulin complex?
It phosphorylates the myosin so
Very
that
good.
the light chain of the myosin kinase on the light chain of the myosin activates. It binds to the actin and muscle contraction occurs.
Wonderful. So, did you realize one thing, Pratisha? You are naturally good in smooth muscle, skeletal muscle contraction in physiology. Lot of students will be weak in this topic, let me tell you. So, when we are preparing for entrance exam, remember, doctor, there is a list of 953 high yield topics. If you don't have these high yield topics, please call our helpline 900868 You will be given the list, and it is already there in the Incus app also. It is there. Sorry, 1 minute. Yeah. So out of this 953, naturally we will be good with around 400 to 500 topics, and naturally we are a disaster in about 400 to 500 topics. Half we will be good, half we are bad. Quickly we need to. Any topper you ask, quickly we need to master those. First, identify where we are bad. Before that, identify what are the 953 topics that you need to become a champion before you go to the NEET PG. And solid, make it solid. That is the whole idea. So, for example, am I audible, doctor? Am I audible?
Yes, sir.
Yeah. So, for example, in the today's broadcast, we are discussing 120 questions. The whole purpose is identify what are those topics that really felt very cringy for you, and you need to cut it down, smoothen it. That is the only way you can be able to improve your scores in the mock test and everything. So that's the point I wanted to emphasize to all of you. So, doctor, very good. Calcium calmodulin activates myosin light chain kinase, which phosphorylates myosin, allows it to bind to actin, leading to the contraction shortening, is what you need to remember. Now, my question to Sandeep. Lysosomal enzyme, absence or deficiency is the problem in which case?
Sir, in all the three diseases.
Right, absolutely. So once more, lysosomal storage disorders, and what are the enzymes deficient? You want to be 100% sure, doctor. Now, a 53-year-old alcoholic, he has splinter hemorrhages, perifollicular hemorrhages, and which vitamin deficiency lead to this kind of hemorrhagic diathesis? My question to Keerthana.
Vitamin C, sir. Option.
Very good. Vitamin C deficiency can lead to it. Now, antigen activity of the bacterial surface. Why a bacteria stimulates our immune system? All except, yes, Dr. Praveen.
A, capsular polysaccharides.
Actually, capsular polysaccharide, capsular protein is antigenic. In fact, it is a nuclear membrane which is not antigenic. Flagella, pili, capsular polysaccharide, they are all antigenic in nature. The larvae that travel through the lung, except Dr. Pratisha.
Sir, option D, Trichuris trichura.
Good. So, what are the list of larvae that travel through the lung? You have any idea of that list, doctor? No? So, good. This is the list. Ascaris, Ensilostoma, Decatur americanus, Echinococcus, Cysticeromia, Paragonimus westermannii. This is very important. Paragonimus westermannii will lead to what is called pseudo-hemoptysis. It is called as pseudo-hemoptysis because it produces the sputum which looks like hemoptysis. That's the point you need to remember. Similarly, structuralis also is what you should remember. Now, doctor, arthropod bone diseases. These are all except Sandeep.
Sir, option A, brucellosis.
Absolutely. Easy question to crack. Brucellosis is transmitted through ingestion, contact, and inhalation, which is tick-borne. Keerthana.
Rocky Mountain spotted fevers. Option.
Absolutely. And Keerthana, in your dirty 200 pages notebook, have you made the list of all that stupid 6 to 7 rickettsial diseases? What are the organisms and what is the vector? Right? That's very important because even in my days, I used to feel like loudly crying to remember all this stupid stuff. There is no relation between becoming a cardiologist and reading all this stuff. Just like we read so much botany, so much zoology to get into medical college. All stupid crap we read. Suddenly today somebody is saying that in Krishnapatnam, near Vishakhapatnam, there is some herbal medicine with which corona is going away in 10 minutes. Oh my God, it's a viral video today. Then I was thinking, If this proves to be true, all our doctors will commit suicide because we had been selling remdesivir, we had been giving so many things and claiming big. Ultimately, just like the botany in the NEET undergraduate days, which is of no relation to our medical school reading, some guy without even a medical degree is creating the what is that called Mirialu and a little of what you call pasupu and all these things. With that, he's creating a medicine. Oh my God, that's Then even preparation for entrance also is more or less like that. All these things, no meaning, but until entrance we need to remember. So what is the disease caused by the cat licking or biting? These are all exact. What is your answer, Praveen?
Sir, B. Bartonella bacilliformis.
Very good. So, Bartonella hansleyi, Pasteurella multilocida, Yersinia, etc. They're all cat. Bacillary angiometastasis is because of Pratisha. Yes, doctor? Yeah, Pratisha, you are not audible. Am I audible?
Yes, sir.
Yes, sir.
Okay. Yeah. So, good. So, we should remember it is Bartonella hansleyi is what we need to remember. Good. Now, regarding pertussis, these are all true except Sai Sandeep.
So the main source of infection in the chronic carriers.
Good. So, in fact, there is no chronic carrier state in the pertussis at all. Erythromycin is a drug of choice. Incubation period is 14 days. Secondary attack rate is almost 90%. They're all the true statements. Acid-fast organisms. These are all acid-fast organisms exact. Yes, doctor.
Option.
Good.
Option.
Typical gut bacteria, Cryptosporum, Nocardia, they're all acid-fast. Protein synthesis is inhibited by all these toxins except. Praveen, what is your answer?
Pertussis. Option A.
Little louder.
Pertussis. Option A, sir.
Very good. So, sugar toxin, pseudomonas, diphtheria. So, diphtheritic toxin also inhibits the protein synthesis. Diphtheria toxin and sugar toxin, they inhibit protein synthesis. And cholera toxin activates the cellular adenylate cyclase and accumulate cyclic AMP. Definitely one question will definitely be asked in the entrance tomorrow. So, Shigella, diphtheria, pseudomonas, virotoxin, which is a Shiga-like toxin of the E. coli. They're all the toxins that inhibit the protein synthesis is what you need to emphatically remember. Good. Now, what is a true statement, Sai Sandeep, out of all this?
Sir, botulinum blocks ACH release.
Very good. So, botulinum lead to development of paralysis because acetylcholine acts on the nicotinic receptors at the neuromuscular junction is what we need to remember, and that is blocked by that is decreased by the decrease in the release of the acetylcholine. Mature B lymphocytes, when they get exposed to a specific virus, they acquire the ability to proliferate indefinitely while maintaining their ability to secrete immunoglobulins. So, how can you be able to confirm an in vivo infection with this virus is typically established with which test out of this?
Is it production of heterophile antibody? Option.
Very good. So, it is a heterophile antibodies that we often use. So, Epstein-Barr virus commonly infects the B cells. stimulating them to enter the cell cycle and undergo a transformation is what we need to remember. So monospot test. A group of farmers develop a disease characterized by high fever, headache, nausea, hemorrhagic skin rash, gram-negative kidney bean-shaped cocci. So now the question is, what is that organism? And which microbial components show that there is a high morbidity and mortality in this given case? Yes, doctor. So what is your answer?
So this is so the answer would be A with the cellular.
Okay, good. So we need to remember that meningococcal lipo-oligosaccharide is responsible for all the toxic effects, and its blood level correlates with the morbidity and mortality, is what you need to remember. A 5-year-old male is brought to the emergency with somnolence, lethargy, and oliguria. Fragmented RBCs, what are they called? Cystocytes, are being seen, and the blood urea, nitrogen, and creatinine are also elevated. That is, renal failure is also there. And first of all, what is this diagnosis? And it is because of consumption of which food? Yes, doctor.
Sir, it is because of consumption of undercooked beef. Sir.
Okay. And what does it lead to?
It lead to the Escherichia coli strain causes itself due to the uncooked beef. It enters into the body and causes.
Okay. So we need to remember E. coli O157H7 lead to hemolytic uremic syndrome. Typically, the children under the age of 10, it is the undercooked ground beef, hamburger's disease is also called as. And typically, it lead to the clinical picture of microangiopathic hemolysis with the cystocytes is what you need to develop. Now, monoclonal antibodies against the CD21 on the surface of the B lymphocytes, they prevent the infection with which virus, Kirtana?
Epstein-Barr virus.
Absolutely. So we need to remember that typically for the viral invasion, initially there need to be an attachment of the virion envelope to the complementary host cell surface receptor. So in the HIV it is the CD4, Epstein-Barr virus it is CD21, and the parvovirus B19 it is the erythrocyte P antigen. That's the reason parvovirus can lead to aplastic anemia. Aplastic anemia is what you need to basically remember. Now, in a developing country, there is a rise of incidence of neonatal tetanus. So, the best preventive measure to control this problem, what is it, Dr. Praveen?
Option C, vaccination of young adults. Because anyhow, from the mother, the IgG will be coming, and they will be easy for formation of immunity in the fetus. So the vaccination for the young adults would be the answer.
Absolutely. So then the immunized mother will be able to pass the IgG through the placenta to the fetus and provide the passive immunity is what you need to remember. A 12-year-old male is treated with methicillin, shows very little response after 2 days of therapy. Gram-positive cocci in clusters. There's a response to methicillin, very little response, but good response to vancomycin. So what is the most likely reason for this kind of antibiotic resistance to the methicillin, neficillin, etc.? Sandeep.
Sir, it is because of the poor interaction with the binding proteins.
Correct. So it is the penicillin binding proteins. It is binding with the penicillin binding proteins is the one which is mainly responsible for the MRSA, is what you need to basically remember. Now, a 34-year-old male presents painless penile ulcer, unprotected sexual intercourse. What is the best way to identify Treponema pallidum, Dr. Keertana?
Ulcer X-ray microscopy with dark field illumination.
Absolutely. So we should be very sure on the spirochetes. Classically, it is a dark field microscopy where we visualize the spirochetes. Now, a 22-year-old serum HIV IgG antibodies. He denies any vaccination against hepatitis. So, what is the laboratory finding most likely indicate if there are HIV IgG antibodies? Ravi.
Sir, it is a self-limited illness, so there must be a past infection that could have been occurred. So if you see an anectic viral infection in the past, so the patient might not have been noticed it, but the infection had been occurred in the patient. So it is option is.
Absolutely wonderful. So anecdotic viral infection in the past is the underlying cause, because IgG indicates chronicity of the condition. Now, these are all teratogenic drugs. Sai Sandeep, which is not the teratogenic out of this.
Sir, it is ampicillin.
So, can you give it to a pregnant woman with UTI?
No,
Very
sir.
much. No, you can. Ampicillin, if there is a UTI in a pregnant woman, so you should be very sure what drugs can be given, what drugs cannot be given in pregnancy. So ampicillin is commonly used whenever there is a urinary tract infection or any infection for that matter, even upper respiratory or lower respiratory infection, safely. Now, the drug that causes this ECG change. So first of all, what is this ECG change, Keertana? What is this ECG change, do you think, basically? So fundamentally,
QT12.
it is a QT prolongation. Right. Keertana, any idea what is the normal corrected QT interval will be? Is equal to dash milliseconds. Only Keertana is going to answer this question. Okay, I'll give you choices. 220, 320, 420, 520 milliseconds. What sounds interesting? 220, 320, 420, 520. What sounds interesting? What is the normal QTC in your? Come on, just like a fun. What is your answer?
420.
420. Chaso right? So 4. In fact, that is correct. Normally it is 420. More than how much you call prolonged QTC. Once more, I'll give you another lucky number. Choose karo. 400, 500, 600, 700. How many milliseconds you call prolonged QT?
100.
How much?
100.
400, 500, 600, 700.
More than 600 is called.
Very good. More than 600 milliseconds you call prolonged QTC. So you should know all the drugs. QTC more than, in this case it is 620. So more than 600 is called prolonged. So haloperidol, amidaron, sotalol. So there is one listed of them. Drugs causing Prolonged QTC. Tomorrow's NEET PG, they are going to ask. You have to write it in the dirty notebook, 200 pages notebook. Which is a bacteriostatic drug, Praveen?
It's AINH.
Yeah.
Sorry, sir. Ethambutol.
Absolutely. It is the ethambutol, which is and thioacetazone, which are bacteriostatic, whereas rifampicin, isoniazid, streptomycin, pyrazinamide. Another very favorite question of the examiner is, what is the dosage per kg body weight of these drugs? You remember this, IREP. In India, who is the one who keep on updating our pharmaceutical knowledge, doctor?
Medical rep.
Medical reps. So Indian reps, you can remember. So 5 mg per kg body weight, that is isoniazid. Rifampicin 10 mg per kg body weight. Ethambutol 15 mg per kg body weight, and this is 20 mg per kg body weight is what you can be able to remember. IREP is what you can remember. Now, as per WHO protocol, which drug is contraindicated in pregnancy?
So streptomycin, sir.
Absolutely. Aminoglycosides are contraindicated. In chronic liver disease, which ATT drug is safe, Keertana?
The streptomycin.
Absolutely. Streptomycin is ototoxic, nephrotoxic. One more favorite question you should remember, sure shot in NEET PG is, which aminoglycosides are vestibulotoxic versus more cochleotoxic versus both? I am not going to give you the list because it is available in every entrance book. Only thing is we will not have that. The whole challenge is everything is there in the book, but to make ourselves prepared to assimilate, that is the whole challenge, right? So not only for you, even we also suffered from that syndrome. Alkylating agent is which one, Dr. Praveen?
Busulfan, option B, sir.
Absolutely. Busulfan. Anti-MRSA drugs, these are all except Sandeep.
Deonicide. Option A, sir.
Right. So, linezolid, vancomycin, dactinomycin, they're all anti-MRSA. Then even imipenem, dalfopristin, quinupristin, upirocin, teicoplanin, they're also effective against MRSA. But tazobactam does not cover. So, Keertana, what is the mechanism of action of verapamil?
Inhibition of calcium.
Absolutely. I think easiest question on the planet. GAN cyclovir, Praveen, how does it act?
Sir, it inhibits the viral DNA virus.
It inhibits the?
No, they're asked what is the false about the ganciclovir. So
Right,
normally
right.
it is used for CME infection, and also we can
Very good.
use for HSV. Same way it is used in Kaposi sarcoma, and only the option left is A. So which does not inhibit viral DNA gyrase because
Which is
it inhibits
inhibited
viral
by?
DNA polymerase.
Very good. So it is a viral DNA polymerase which is inhibited by the GAN cyclovir. So I think our first session of combined study, did you enjoy Sandeep, Keertana and Praveen? Right?
Yes, sir.
So
Yes, sir.
to finish 100 questions, we will take a longer period of time. Imagine the power we will have Every day we sit in the evening and finish 100 questions. Within a span of 2 months, around 60 days, 60 into 100, 6,000 most essential questions we will finish. And every day we finish 100 questions. Let us go back, identify 5 to 10 topics and then strengthen them. That's all. That's the only way to succeed in entrance exam, right? And once more, thanks to all our online students, Dr. A.K., Maulik Panchal, Lavpreet Singh, Tapriya Sahu, and many more. And anyone want to join this evening combined study program, don't forget to call our helpline and we will send you the link to join this live stream. And every day, let us do a revision of 100 questions in the evening, 6 o'clock. See you all tomorrow once more at 6. Thank you.